Hi, my name is Kirsten. I'll be your nurse today.
Hi.
How are you?
I'm good.
Good. We're going to do a neurological assessment, and so we're just going to examine your 12 cranial nerves, as well as a couple of other questions. I wanted to video that. Would that be okay with you?
Yes.
Excellent. Would you mind signing? I have a consent form for you. Thank you. Can you tell me the date?
October 23rd.
And what is your full name?
Lori Morris.
And where are you right now?
Redmond in Rome.
Excellent. So we're going to just walk through the 12 cranial nerves. The first one is olfactory. It's responsible for your sense of smell. What you're going to do is you're going to occlude or close one of your nostrils and blow out. Excellent. You can hear the air moving, and then do for the other one. Okay, now if you'll close your eyes, I'm going to put a familiar scent, and if you could identify it. What do you smell?
Cinnamon.
Excellent. The next one is the optic nerve, and it actually is responsible for your sense of sight. So just the actual ability to be able to see.
Okay.
Now, we can do that with a Snellen chart. Today, since I don't have a Snellen chart, we're going to do it with, if you'll just hold and then open the other eye. And how many fingers am I holding up?
2.
And if you'll close the other eye. And how many fingers am I holding up?
3.
Excellent. And then if you could read this sentence right here.
YMCA mission and purpose statements.
Excellent. So we would go more in depth if I was testing your actual specific vision. However, since we're not in the ophthalmologist's office, there is no reason to do that today. And if you had any problems, then we go further with that. The next is your the next three nerves, your 3, 4, and 6. They're the oculomotor, the trochlear, and the abducens. It's responsible for your actual eye movement, your motor control. So I'm going to turn the lights off, and I'm going to look at your pupillary reaction. Okay. Excellent. And so your pupils are round and reactive to light. And then also we're going to look at your fields of gaze. They're called your cardinal fields of gaze. And so if you'll just follow my finger, and then let me know if my finger ever comes out of your eyes, your view of sight. Excellent. And then your next is your trigeminal, and it actually is your sensory nerve, and so it's responsible for your ability to determine if something is sharp or soft, the quality of touch. So I have a paper clip, which would be sharp, and then a cotton swab, which of course is soft. So if you'll close your eyes and then let me know if you feel sharp or soft, okay?
Mm-hmm. Sharp. Soft. Soft. Sharp.
Look at your leg here.
Soft. Sharp. Sharp. Soft.
Excellent. And then if you didn't respond well to that, if there seemed to be a deficiency, then we would have done your corneal reflex, which you touch the inside of the eye, and there's a reflex that is normal. However, you don't need to do that since since you passed this part of the test. The next is your facial nerve. It's nerve number 7. It's responsible for your motor nerves in your face, as well as your sense of taste. So if you'll puff your cheeks out and squint real tight. Excellent. And then if you'll close your eyes again, I have something to drink. And you let me know what that is. It's something familiar.
Lemonade.
Fantastic. The next is your acoustic. You can open your eyes. The next is your acoustic, which is nerve number 8. It is responsible for your actual ability to hear. And there's many ways we can assess that as well. However, I'm going to just do a whisper test behind you. And so I'm going to whisper some words, and then if you'll just repeat them, okay?
Okay. Red. Purple.
Excellent. The next is your glossopharyngeal nerve, which is nerve number 9. It is responsible for your ability to swallow. This is, of course, very, very important, not as if the others aren't, but it's something that is deficient a lot of times if you're having a stroke or after a stroke. So what I'm going to do is give you something to drink, and picture my hand here on your kind of your Adam's apple. However, we're not men, but and then I'm going to feel your ability to swallow. That's what they would do in the hospital as well if you were to ever have a stroke. There you go. Let me just swallow now. Excellent. And the next one is your vagus nerve. It's responsible for your gag reflex, and then also it helps by bearing down, as if you're going to go to the bathroom. You can actually lower your blood pressure, which is important in those real critical situations. So you'll find a lot of times in the hospital, if for some reason you had a hypertensive crisis, that ask you to what we call vagling down, and that refers directly to the vagus nerve. So the gag reflex is also important. It goes right along with the glossopharyngeal nerve. So if you'll say ah, then
Ah.
Excellent. And then your spinal accessory is I'm going to look at the symmetry of your trapezius as well as the tone. You would have a thick and even barrel chest to look if you were breathing with your accessory muscles rather than abdominal breathing or lower through your diaphragm as one should breathe. And then also, I'm going to put my hands right here if you'll push against me. Excellent. And then lastly is the hypoglossal. It's a motor nerve. It's responsible for your tongue strength. So the first thing I'm going to do is, again, I'm going to use the Q-tip, and I'm going to push against you're going to stick your tongue out. I'm going to push against it on each side. And then I have some words for you to repeat. Okay? You'll stick it out. Excellent. Excellent. And then could you say tight, light, and dynamite?
Tight, light, and dynamite.
Excellent. So do you have any questions at all about this exam?
No.
Okay. Well, thank you so much for coming in today. I appreciate it. Please call us if you have any concerns, okay?
Okay.